Hey, it's Dr. Shelley, and you are scheduled for a marsupialization of your Bartholin cyst in the office. Now, the marsupialization is actually cutting the cyst and opening it up further to keep it from recurring. If you're getting a marsupialization done, that means that you've already had an incision and drainage of your Bartholin cyst either recently or sometime in the distant past, and it's come back. And so we're trying a different option now to keep it from coming back so quickly, or if we're lucky, from it coming back at all. And so when we do the marsupialization, like I said, it's think of it like a cross cut, and basically then you're peeling it back like the leaves of the petals of a flower, and so that's making the opening much bigger than if we're just poking a little small hole in it and putting that wart catheter in there. Sometimes it will go ahead and still put the wart catheter in at the time of the marsupialization. It depends on how big the opening is, and what my thought process is at that time. Now, when we marsupialize the Bartholin cyst, that does not guarantee 100% that it cannot come back, but it certainly is definitely the superior procedure compared to just a simple incision and drainage. As far as the risks that go with this procedure, the risk of any surgery is the same as with this procedure itself. There's a risk of infection. Now, a lot of times the Bartholin's cysts can be Bartholin's abscesses, meaning that they already are infected. Then if that's the case, then obviously we will put you on antibiotics. You may already come in on antibiotics, or I will put you on antibiotics at the time of the procedure. But otherwise, I will not, unless you are diabetic or you have markedly elevated sugars. If so, if I have not given you a prescription for an antibiotic, then yes, please let us know so that we can put you on one. Otherwise, there's a risk of bleeding. That's the same as with any surgery, but usually there's not significant bleeding with this particular surgery because we use numbing medicine locally that has a constrictor in it to decrease the amount of blood loss at the time of the procedure. Will you have some bleeding? Yes, but not enough that we would be concerned about. There is a risk of damage to adjacent organs. We are functioning at the opening of your vagina. We're not trying to hurt the inside of your vagina. We're not trying to hurt your groin area. Um, I don't know quite how we would get there, but we're not trying to hurt your bladder or your bowel or your ureters or anything else that's sitting in the pelvic region. We're also not trying to hurt any of the nerves or blood vessels that are in the vaginal area or the vulvar area, which is the area we're operating in. With any surgery, we have to tell you that there's a risk of deep venous thrombosis, which is the blood clots in the legs. Another word is DVT. It's not that you would actually have that occur usually while you're in the procedure because you're moving around while you're in the procedure. And the biggest risk of a DVT is actually when you're put to sleep at the hospital, and we're not doing that in the office. But we have to tell you that because, once again, that's a risk that's associated with any surgery. If you had a DVT in your leg and it broke off and went to your lungs, that's a bad thing. That's a pulmonary embolism, and that is, we do not want a pulmonary embolism to occur. That can cause severe shortness of breath, chest pain, and could lead to death. So we don't like those things at all. And obviously, with any surgery, I have to tell you that there's a risk of death. We expect nothing bad to happen to you, but we have to tell you that that's a risk because, once again, that goes along with any surgery that you have done. And I tell people, you take your life in your hands every time you get behind the wheel of a car, and we do it several times a day. So this is a very simple procedure. There should be no risk of that, but we have to tell you that that is a possibility. The As far as what you're going to do before you actually get there for surgery, if your surgery is in the morning, you are going to eat your breakfast. You're going to take your normal pain your normal medications. Do not take pain medicine. That's the one thing I don't want you to take. But especially if you have high blood pressure, I need you to be towing the line before your surgery. I will cancel your surgery if your blood pressure is too high. And obviously, we need good sugar control if you are diabetic. So those medicines definitely need to be on board. Otherwise, if you have other medications like cholesterol or something like that, and they tend to upset your stomach, then by all means, you can wait until after you get home to take those medications. But I need blood pressure medicine on board. I need sugar medication on board, and I need you to eat breakfast. If your procedure's in the afternoon, I need you to eat breakfast and lunch. And the reason why is because when anybody, even if you think you're cool as a cucumber, when you get in there and you're getting ready to have a procedure done, we tend to get a little nervous. And so when you're nervous, that can cause us to feel faint. If I'm sitting there with no sugar, that can cause me to feel faint. We don't need a double whammy in there. We don't like you on our tile floors. They're kind of hard. And so we kind of like you to be well hydrated, meaning drinking your fluids, eating your food, before you come in. Even if you don't normally eat breakfast, I need you to eat a little something. It doesn't have to be eggs, bacon, and toast, but it should not be black coffee as well. If you really have concerns about it, certainly let the staff know, but we can come up with some things for you to put into your belly. Smoothies are great as long as you're used to doing smoothies if you don't want something heavy. Okay. Like I said, please don't take any pain medication because we're going to give you pain medication when you get there. And if you've already taken something, you're going to get into you're going to interfere with the things that we want to give you. The procedure itself, you want to plan to be in the office for 2 hours. The procedure does not take 2 hours. The procedure takes about 20 minutes, but we have you come to the office about an hour in front so we can get you comfortable, we can get you changed, we can get some pain medication on board, we get everything situated to do the procedure. Then we do the procedure, like I said, for about 20 minutes, and then if you're looking like this, you get to go home right away. If you're looking like you need to lay there for a little while, then we let you lay there for a little while. We tend to use laughing gas, so the other word is nitrous oxide, for our pain control during most of our procedures. And then we use localized numbing, of course, as well. If you use the laughing gas, it doesn't mean you can't feel anything. We're not putting you to sleep. You will feel, but it won't be any sharp pain or anything like that. And then when you do feel it, pretty much everything is funny, including any discomfort that you're having. The great thing about the nitrous oxide is it's in and out of your system immediately, so you do not need a driver. You will be completely functional, and you won't feel woozy the rest of the day. Um, the one time we don't want to use nitrous oxide is if you are a super anxious person, because nitrous oxide does not control anxiety. You'll just be actually laughing and crying and still super anxious. And so if you are anxious and we have not already had the conversation about addressing your anxiety with the procedure, then you do need to let my surgery scheduler know. And we can actually switch the procedure and do it with anxiety medication as well as pain medicine and not use the laughing gas. The negative of that is that you have to have a driver. We will not let you behind the wheel of a car if we have given you an anxiolytic. And it can make you feel kind of, woozy high for the rest of the day. It depends on the person and how sensitive you are to those kind of drugs. Either way, whether you use the nitrous oxide or the anxiety medication, you should be fine for functioning as far as uh, not feeling woozy or anything like that the next day. Of course, with the Bartholin cyst, you can be ouchy, and so I usually recommend after marsupialization that you are planning to take a couple of days off, just because, of course, it's hard to sit if we have been operating on your vulvar area. I want you to bring some fuzzy socks and a throw blanket because our office can go from hot to really, really cold. And hot, we can take things off. But if you're freezing cold and you have nothing to cover up with, 2 hours can be a very long time when you are shaking in your boots. So please, please, it's better to bring it and not use it than to be laying there the whole time wishing that you had your blanket or you had some socks to put on your freezing feet. I think that we covered everything. Let me see. You will get medication to take for pain, and we'll talk about what to do after the procedure in a separate video. And trying to think if I forgot anything. I think we're good. So I will see you the day of surgery. If you have any questions after you have watched this video about the procedure, then we can certainly discuss it with my surgery scheduler. And if she's not able to answer those questions, then she will track me down and we will try to get you those answers. Well, we definitely get you those answers before we get to the day of surgery. And so if I don't see or talk to you before then I will see you on surgery day.